You're listening to the Doctors In podcast from martinclinic.com. Although we share a lot of practical and, in our opinion, awesome information, what you hear on this podcast is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes. So enjoy. Hi, I'm Dr. Martin Jr.
Dr. Martin Sr.
And this is the Doctors In podcast, and this is episode 165. Now, today, we're actually nearing the end of 2018, which is just incredible to think about. We're recording this episode. It's towards the end of December, less than a week away from Christmas. And it just seems like this year, I remember recording the first podcast of this year. I mean, that's how fast this has gone by.
Yep.
But today what we want to do is we want to talk about something that we get asked a lot via email, a lot of times via live chat on our website. You see this a lot in the clinic, and it has to do with menopause. So today, we're going to talk about menopause, and specifically what is normal, what's abnormal, and what might be due to something else. Because that's one of the tricky things with menopause is you like to talk about the Bermuda Triangle of hormones, which is the connection that the adrenals, the ovaries, and the thyroid have. So if any one of those things get affected, the other two go along with it. So it's rare that a person that has a lot of menopausal symptoms, they'll have other issues, but we'll talk about that. But the first thing I want to do is if somebody comes in to see you, right? So they come in to see you and they start talking about menopause. They say, I'm menopausal and I have these symptoms. What in your head triggers something that says, okay, this is more than it should be. This is more than normal.
Yeah.
There's something else going on, or there's something.
Yeah, and listen, I mean, just to make people understand, I mean, women know this, but we'll give you a little. From the day you ovulate till the day you die, ladies, you need to have estrogen and progesterone. Those come out of the ovaries, and those are hormones that you absolutely need to have balanced. So from the day you have your first period till the day you have your last period, you've got to have estrogen and progesterone functioning at the same level. So menopause, what is that? I mean, obviously menopause is when now you're not going to be secreting near as much estrogen and near as much progesterone. I mean, you're not going to have a baby and you're getting older. So it's very, very normal. Menopause is normal. It's just stop having a period. It's just simple as that. Your body is lowering its levels of estrogen and progesterone. And I have a lot of patients that menopause, they were praying for it because they said, I don't want to have any more menses, and I'm tired of that and blah, 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 right? And, I'm praying for menopause. And I always say this, I said, be careful what you're praying for. Because menopause can be a wonderful thing because, hey, no more periods, blah, 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 ladies. But you better be balanced. Because if there's any imbalance, I always say it's almost like you're flying in an airplane and everything is smooth, and then all of a sudden you hit turbulence, right? And you're holding on to the seat, you're going up and down and that's what can happen as a woman's body starts to change. If everything is equal, estrogen, progesterone are equal, smooth sailing, very little turbulence. Yeah, they might get the odd hot flash. They might get a little bit of night sweats at night. But generally, they're feeling very good. Their energy is good. They don't have any big changes in moods, and they don't have any belly fat that's coming on or whatever. Some of the major symptoms that when you are hit turbulence in terms of hormones is when you literally think, for some women, that they've been invaded. Like somebody from outer space has come over and...
The body snatchers.
The body snatchers come over and taken over their body. They're moody. I mean, they are literally up and down. They can fly off the handle in 5 seconds. They can have anxiety.
And that tells you that they got a problem with cortisol, which we'll talk about.
Yeah, big time, right? So a lot of them is cortisol. A lot of them are thyroid symptoms, right? Where they're gaining weight. I mean, Doc, I never gained weight. I always had the same pair of jeans and the same size, and all of a sudden they got belly fat. Well, that's cortisol. But even hair loss, their hair is thinning out. They're dry. So sexually, think about that, right? Their skin is dry. and their lubrication is something they're missing. And now, sex can become painful for a woman. It's very traumatic. Think about that. Like men, what do we got? We got, like men, we don't have anything like they said there's such a thing as andropause for a man.
Which would be the testosterone issue that a lot of men experience.
And they can get that.
Yeah.
And sure enough, they have symptoms, but we're big babies. I mean,
we're not supposed to admit that publicly. That's something that, like,
but we're woman doctors.
That's a code that's been passed down from generation to generation. We're never supposed to publicly admit that. It's
but my wife and your mother knows, and I'm sure your wife knows too. We're big babies compared to them. Anyway,
well, actually, science would back us up a little bit, because the concept of the man flu, it is a funny thing. There's actually a lot of funny memes or little funny pictures that I like to put one up every once in a while because it's funny. It just says only after the experience of childbirth can women even slightly understand what men go through when they have a fever, right? Like we're big babies. We'll be the first to admit that.
For sure. But big changes. So it depends on, remember now, the cause is imbalance. It's not disease. Menopause is not a disease. It is imbalance. It is a fluctuation.
Well, which is why menopause, the generic term menopause, in a sense, is a symptom of an unbalance, like you mentioned, right? It really is. When somebody has a very unpleasant menopause, or really perimenopause is really what's going on, it tells you they're unbalanced.
Yeah.
And
for sure.
It's just coming out.
And again, just on a little bit of a negative side, like when you look at just off the top, like some of the things that are done, you have thousands and thousands and thousands of women that are put on antidepressants, and they live on antidepressants for hormonal issues. Really, they hit turbulence, and they are put on, like you hear a knock in the engine, and let's turn the radio up because you didn't fix it. You didn't balance out the hormones, and that is a major issue, or can be, especially in menopause, where you don't feel good, and your energy is not what it used to be. You're not sleeping, obviously. I mean, if you think of those symptoms of hot flashes and night sweats, and you're hot, you're cold, and the covers are off and the covers are on, and, your fluctuation body temperatures, weight gain. I always tell women, my goal for you is to be healthy and balanced. And then the patient stops me and says, okay, doc, and when am I going to lose weight, right? I said, well, you're hormonal. Like, your hormones are not balanced, and that's a big issue when it comes to that. So these are all possible symptoms. Some of them are caused, like we always say, cortisol it's the accelerant. You already got an imbalance because of estrogen, progesterone. And listen, the other treatment, just to come back, one of the things that doctors like to do is to put women on estrogen and synthetic estrogen, right?
And that's got a long, bad history.
Listen, they are warned with their lives, doctors. You got to be careful with giving out that stuff. And they don't, necessarily like to give it, but they, what am I going to do? I got to get, I'm very, very careful with estrogen. Usually the problem is you already got too much estrogen. It's not estrogen,
and that's
per se,
something
it's
that
the imbalance.
I think needs to be said or explained, because this is something that people have a hard time understanding, because they think menopause, they naturally associate I'm losing estrogen, and then they get all the symptoms of estrogen dominance, and it's like, well, that doesn't make sense. How can I be estrogen dominant yet I have less estrogen? But here's the thing. What's happening in menopause is they lose the estrogen, as you mentioned, and they don't make as much progesterone. Yeah. And estrogen dominance doesn't necessarily have to do with the amount of estrogen you have, but only the amount you have in relation to progesterone. Exactly. So you can be estrogen dominant and have less estrogen, but you have even less progesterone. Yeah. And so you get estrogen dominant symptoms.
And as you're getting older, you're going to have less estrogen. That's normal. It's part of menopause that you're going to, or perimenopause, you're going to have less estrogen. But that's not the key. The key is how much the progesterone is always the one that levels those two out. You've got to have, it's like a teeter-totter. You got to have both. Like if you're up with estrogen, you're going to be down with progesterone because it's always in relationship. And by the way, I don't know if I've ever seen this, and I mean it. Like, I don't know if I've ever seen some woman, no, I can't say that I have. with too much progesterone, where they're secreting too much progesterone. I just haven't seen it. So the key is estrogen. The key is balance. And these are some of the main symptoms that come up.
And it seems like there's such an increase in perimenopausal symptoms in women. And as you mentioned, there's an accelerant, right, which just makes things worse, which is cortisol. And what's interesting is cortisol and progesterone, they are made from the same, they call it like the mother hormone, right, which is pregnenolone. Think about it. If you always need to make more cortisol, you're going to do that at the expense of making progesterone.
Yeah.
So you can imagine.
That's why women are so different. Stress hits them so much differently than a man.
Yeah, stress in a guy, can affect their testosterone levels, and it can affect their insulin levels, and it can do a whole bunch of stuff there. But with women, it hits them in that Bermuda Triangle of hormones that you always talk about. Mm-hmm. It accelerates that problem, and then same thing, it will make menopause that much worse. There was an interesting study that was done that looked at basically the greater amount of hot flashes and the intensity of it, and they looked at the cortisol patterns of all these women. And of course, the study's saying it might be more of a cortisol problem.
Yeah. Is it more stress than it is? Is it more stress than
it's just that when you're menopausal or perimenopausal, stress will give you night sweats and hot flashes. When you're younger, less of that, but it will still give you different symptoms, right? So, which makes it very interesting. So stress, cortisol, will make menopause nuclear, makes it that much worse.
Yeah. The accelerant.
So their night sweats are worse. Their insomnia is worse. All those things get worse as they're going through it because of too much cortisol, which is interesting. So, all right, so we talked about the symptoms, abnormal symptoms in a sense. If somebody comes in and these are abnormal symptoms, right? What's your approach to this?
Well, I like to look at functional medicine is always looking at symptoms and seeing what is the primary factor. Because sometimes we talked about it, like you can have three things really get messed up: your estrogen, progesterone levels, your thyroid levels, and your cortisol, which is coming out of your adrenal glands. And by the way, ladies, a lot of women go, well, why am I having trouble? I had a hysterectomy. And so you would think like everything's going to be hunky-dory, right? But what has to be taken into account, and women often don't know this because nobody's told them, is that, you might, even if you've had a complete hysterectomy, that doesn't mean that you're not secreting any more estrogen or progesterone, because your body has plan B. Your adrenal glands will take over and make sure that you are secreting. Now, you're not going to secrete, obviously, as much as you used to have. But even because a lot of women, they have a partial hysterectomy, and they have because of either endometriosis or they had terrible bleeding, they were anemic, they had polycystic ovarian or whatever, and maybe they saved one ovary and the other one's gone. But because I've had women say, well, if I have a hysterectomy, everything's going to be perfect after that. But what they don't realize is, but you got to remember, you still got your adrenals and you still got your thyroid. And your body will still secrete some estrogen and progesterone because you got plan B. So don't think if you're out of balance, and obviously if you had a hysterectomy, you were out of balance. You had way too much estrogen, right? Compared to your progesterone. That's the cause of any kind of women anatomy. When that thing goes south and they start having trouble, it's always estrogen. Estrogen is the dominating hormone, gives them all sorts of trouble. Okay, so what do? I always look to get them back to balance. I want to lower their estrogen. If it's menopausal, I want to elevate their progesterone levels. We can do that naturally. And we look at cortisol. It's a huge, huge factor. We look at the thyroid. If there's thyroid symptoms, we address the thyroid. Because if you don't address all of it, you're not going to fix it. This is generally what we do. We'll look and see what is the major things, what are the major symptoms. We treat those symptoms. We treat the symptoms because they got to get relief, and that's what they're not coming to see me for any other reason, right? They don't come to the Martin Clinic. They want results. So we just got to figure out, and sometimes we've got to tweak certain things, but generally we got a great protocol to fix the key issue and get that balance back in the hormonal triangle that we're talking about.
Yeah, so just to recap that, so when you approach perimenopausal or menopausal symptoms that have gone crazy because of an imbalance in the Bermuda Triangle of hormones, which is basically what you talk about quite a bit, you will address the issues in the Bermuda Triangle of hormones. So you will address the adrenal issues, you'll address the estrogen, progesterone issues, and the thyroid issues.
Yeah.
And what's interesting is that if they're having, like, unfortunately, we always talk about this off air, how the thyroid, it's kind of like that whack-a-mole game, right? Remember you go to a carnival and there's that little mole that pops up. You got that sponge hammer that you're hitting it, right?
Yeah.
And you never know if you're hitting it or whatever. It just seems to pop out all over the place, and these artificial points show up on the board all the time that you're hitting this thing. That's the thyroid. The thyroid is the mole, and everything hits it, right? I mean, if you have a cortisol problem, your thyroid is going to get messed up. You have an estrogen problem, your thyroid's going to get messed up, which is why a lot of times a lot of women think they have thyroid problem, because they do have a thyroid problem. Yeah. But it may not show up on a blood test.
Yeah.
And we talked about this as well off air, and we wrote a newsletter about it a couple weeks ago. This is interesting because it's a visual thing for people, right? If everybody always thinks that the hormones, you just make like all these hormones, like thyroid hormones, for example, like you just, you make buckets of it and buckets of it all year. And the reality is the thyroid is so powerful, right? It is so powerful that if you were to add up the amount of thyroid hormone secreted in a full year, so 365 days, a full year of thyroid hormone in this is a healthy thyroid, it's about a teaspoon worth of thyroid hormone. It's not much. The body does not need a lot of hormones. It needs the right amount of hormones, and any deviation from that. So that's what makes the thyroid so frustrating. Because if you think about it, it's only...
How do you measure that?
It's a teaspoon.
Yeah.
So if somebody gets a drop less than a teaspoon, they may be so sensitive, and that's the thing. Their levels, they may be more sensitive to it or more resistant to it, that even the slightest change of that messes them up so bad. They go get testing, and the testing is not good enough. It really isn't at this point.
How many women tell us, I knew it was my thyroid. Because I come in and I go, your thyroid's not working properly. And they go, I knew it. Like, it's amazing. I
well,
probably
if you have
saw
the
5
symptoms
women
of thyroid,
this
if you have thyroid symptoms, your thyroid's not functioning properly. And that's the reality of it. You can go get it tested and get these numbers and all these kind of things. But the reality is your body is giving you symptoms of a thyroid because your thyroid's not working. It's not optimum. We always use this term optimal, right?
We know that.
So your numbers could be okay, but it's not optimal for you specifically. Yeah. And so these labs, they use these ranges. Well, those ranges, some of the ranges are ridiculous. For example, testosterone in men, it's like...
Well, isn't it 20 to 1,000?
Yeah, I mean, that's ridiculous. It's
ridiculous. What if you're at 400? Is that good, bad, or ugly?
If a person used to be at 800 and now they're at 400, the test would say they're normal.
Oh, yeah.
If they drops 400 points for that guy, he may not feel good at all. No. Thyroid's the same way.
Oh, yeah.
Your thyroid is so finely tuned and it's so powerful, you don't need a lot of it. So the slightest microscopic decrease in the amount of thyroid hormone you produce will have drastic effects on how you feel.
Yeah.
And that's why the question, we always say this, the ultimate question is, how do you feel?
How do you feel? Yeah.
So when it comes to menopause is really telling you, if you're having a hard time with menopause, you're an unbalance in that Bermuda Triangle of hormones.
Yeah.
And you got to fix those things, and then it's amazing what will happen. And all these other symptoms you never even associated with it, it's amazing what happens.
Well, think of that anxiety, depression. It's so common, it's unreal, right? And I mean, come on, I did people that have never been depressed, and now they're not sleeping, and they got oh man, I mean, the cascade of possible ramifications, symptoms from being imbalanced, and women they become extremely frustrated because generally, physicians are not listening. They're not listening. They're testing, but they're not listening. And we got to listen because, hey, you got clues and, your body's screaming at you, I'm in balance, but you got to listen to that because You got inside information.
Well, and a lot of times, that old TV show House MD, where every week was like the weirdest, oddest, strangest, never seen medical condition, right? And he's like a medical, like Sherlock Holmes. But the reality is, the body is not that difficult. Most of the time, the body will tell you it's wrong if they're listening. And that's the problem. So a lot of times, the body will pretty much say, my thyroid's not working. And it's just, are people listening to it, right? Is the doctor listening to it?
And the thing is, too, and this has sort of been a motto at the Martin Clinic for years, what trumps lab test? Your symptoms, right? It trumps it because they're more important. I mean, you know your body. I always tell my patient, you know your body better than I know it. So you tell me how you're feeling. This is why, I'm all into questions because I want to know they got inside information and then people, they come in and they go, I got to fill out a questionnaire. You asked me the same question 10 times. I meant it, though.
Oh, yeah.
You know what I mean? Yeah. I mean it because I want to know. You're going to give me some, and then I know exactly, with all the years of experience, both you and I know that. We go in and target because we ask specific questions because those are huge clues. And same thing with menopause. You're getting symptoms, and I go, nah, you're not balanced. And they go, well, gee, my blood work was good. I got this tested, and
but they got bad hot flashes. They're not sleeping. They're feeling anxiety or depressed, and so I mean, it's an interesting discussion. And again, we do get that question asked a lot of times, but a lot of times they're asking about menopausal questions, but that's not necessarily that triggered in a sense that decreased production triggered a cascade of chemical reactions that now are leading to this, but the problem is really in that Bermuda Triangle of hormones that you talk about so often. And we talk about that in our Metabolic Storm program, which is now available for free on our website. That program there is fantastic. It's helped so many women understand their hormones and then also what to do with them. And you can get that on our website. I mean, if you go to martinclinic.com, it's right on our main page.
I've told physicians to go there.
That's a great...
I said you need a... I said you need a refresher course on hormones.
And it's practical in a sense because we talk a lot about symptoms, right? And it's a great program. And like I said, it's a free thing. It's a lot of information, but it's a fantastic program that you can go through. So you can go right to our website, our homepage, martinclinic.com, and access that program. Again, we want to thank you for listening and have a great day.
Thanks for listening to the Doctor Is In podcast from martinclinic.com. If you have any questions, you can reach us at info@martinclinic.com. If you're not a newsletter subscriber, you can head to our website and sign up for free. We also have a private Facebook group that you can join. It's a community of awesome people. Finally, I do a Facebook Live every Thursday morning at 8:30. Join us again next week for a new episode.